Her earlobes gave it away, but it's not just that. You'll notice it once I show you. So everyone's seen the recent videos of Margot Robbie, and she's looking absolutely amazing. One of my favorite actresses. But recently, unfortunately, she has been looking a little bit tired, and you can see that age is starting to creep up a bit. But with these latest revelations and the latest video, we can see that there's just been a glow up. So let's break it down. I'm Deep from Deep Aesthetics. The nose. Notice how the bridge appears smoother now, and the tip is much more refined. Could this be a rhinoplasty? It's possible. It could just be strategic placed filler, which can achieve the same look. Subtle, well done. Both can achieve that beautiful contoured and straight appearance. The eyes and the eyelid. I noticed this in one of her recent interviews. They appeared quite hooded, but now, looking at the more recent videos, they look so much more open, so much more lifted. So this could indicate a blepharoplasty going under the knife, or she could have had some filler placed in the upper orbital rim, something that we do quite commonly here at Deep Aesthetics. And also the endo lift could really tighten and lift the upper eyelids also. So the cheeks and the buccal region. Earlier in her career, she had a much more softer, more angelic look. Recently, it looks a lot more linear, a lot more chiseled. The sharper contours could indicate a subtle buccal fat adjustment with surgery. This could also be achieved with the endo lift, laser to liquefy and tighten the area and fat around here, or very subtle cheek sculpting with hyaluronic acid fillers. If this is fillers, this is exactly how it should be done. This maintenance of volume allows Margot Robbie to keep it subtle, so the changes are never significant. She just maintains what she already has. This is filler done correctly. The work is minimal yet effective. What I can see, she's not really focused on volume, but more of a structural change. One thing we have to mention when we're talking about Margot is her skin texture and just the beautiful glow she has. Her skincare radiance is often praised, and this is often achieved with something quite minimal, non-invasive, such as the fractional CO2 laser. The mild resurfacing of the CO2 laser can achieve glass-like skin results. And also keeping up to date with your chemical peels and micro needling will also provide you with that radiant glow, as well as your general skincare. Now remember, this is all hypothesis because Margot herself hasn't come out and confirmed anything, and it could also just be lighting and shading and really good makeup. Margot's changes are subtle but deliberate. She's not overtly done. There's nothing over the top, but there is certainly some refinement. Whether it's her nose, her eyelids, her cheeks, all of it's subtle, none of it's screaming extreme surgery. Either way, she remains a masterclass in balancing that aesthetic beauty and aesthetic nuance. Follow for more celebrity breakdowns done right. Comment Margot if you want me to map out your face. I'll DM you a face assessment cheat sheet for free. Please drop a like